Homeostasis of body is maintained by kidney. Two kidneys that we have in the lumbar region at the back actually work all through overnight in terms of helping us to excrete the excessive amount of waste products which are there in the body. So what does kidney do? It purifies blood, brings about all the waste products from the blood and keeps the blood in a situation where it maintains the body's homeostatic mechanism. The kidneys take the brunt of all these solutes which are in excessive amount in the blood, and that brought about in the kidneys will have to be dissolved into a solution which is called urine and excreted by the excretory mechanism, which is taken charge by us when it reaches the urinary bladder where we empty urine. So the aspect of stone formation in the kidney is a lot related to the theory of supersaturation of urine. That means urine is supersaturated with those solutes which are in higher amount than expected. They are high enough and they cannot be in the solution, and therefore they're suspended. They nucleate and then they aggregate and then they crystallize and form stones. So stone formation is a lot related to excessive amount of solutes in the urinary environment. And in the region of the papilla, which is the region of highest concentration of urine, stones could actually form, and that's where we see those small stones at the level of papilla when we reach it. So our aspect as a urologist would be to look at other ways to prevent stones. What do we do to early stones and how do we prevent stone formation for the future? So to make it short, number one, early stones are the ones which are small stones picked up by a sonography and a CT scan. And the natural history is they've already nucleated, aggregated, and crystallized to form stones. Some of the crystals get passed in urine, which you pick up in urine examination. But the stones which are in the kidney have only two natural history. Either they will grow and gradually become bigger and bigger, or either they could become one to multiple, or there's a possibility that these stones gradually will fall down and cause a ureteric colic or a discomfort and pain at odd times and odd hours because they decide to come down the kidney, walk down that narrow ureter, which is 24 to 26 centimeters in adulthood, but is very narrow. It's as narrow as your mobile charging wire. So the ureters are very narrow structures which don't let more than anything like urine pass out. They're not made for us to take telescopes inside. They're not made for patients to form stones and drop into the ureters and wait there forever. So small kidney stones in the region of anything between 4-5 millimeters to 8-10 millimeters today are being treated prophylactically by retrograde intrarenal surgery or RIRS. Flexible ureteroscopes through the urinary passage can enter all the way to the kidneys, pulverize and powder the stones and pick them up. RIRS or flexible ureteroscopy was in an era started basically for picking up stones earlier and clearing them. It was more used for the group of people who were marine engineers and sailors and pilots and air hostesses from the seafaring and the airfaring industry by us as medical community, because they had to be cleared completely of even the smallest stones before they could be back in the job. For people on the land like you and me, perhaps we could escape that, but we knew the natural history of stone formation was only 2. In other words, the stones will gradually grow from 3-5 millimeters to 1 centimeter and beyond over years, slowly and gradually. And by the time we would know about it, it would be too late. So if we continue looking at ultrasounds every year and the stones are gradually growing or numbers are increasing, remember that there are 2 things waiting to happen. The stones may fall down and they may cause that kind of an injury to the ureter, or they may fall down and give you that overnight discomfort, which is acute and severe on one side, and it falls down and tries to come down. But it cannot come down completely all the time because the ureters are narrow structures. Ureters are broad at the top, so a stone can enter the ureter, but it becomes narrower and narrower as it comes down and becomes narrowest at the lowest part, called the vesicular junction. So all stones in the kidney can be treated today. In the era, we used to do lithotripsy more frequently. We used to pulverize and powder the stone. But when we pulverize and powder the stone by lithotripsy from externally, that's called ESWL, we expect a young fit patient to be able to pass fragments down the ureter. The stone burden is large. We normally will use to leave stents. Today, in the era that we know that there are 1 or 2 stones sitting in the kidney for a year or 2 years, the best way will be prophylactically take a telescope all the way up, use a flexible ureteroscope, get into the kidney, pick up the stone and clear it up. So that's called RIRS or flexible ureteroscopy. As I said, once a stone former, always a stone former. The worry always is that we could form the next and next stone. In other words, this stone itself can get bigger and bigger with passing time. So to safeguard the kidneys and kidney health, one of the important aspects is if you are a stone former in the past, you need to get evaluated with metabolic workup, which helps us to pick up the reasons of stone formation in a subset of patients. In the large subset of patients whom we can't identify, we put them on a very progressive and a very aggressive kind of a follow-up, and obviously picking up stones earlier rather than later. Also look at attempting to prevent stones by a little bit of changes in the dietary habits and the liquid intake, improving their water, improving the citrate levels like lemon and orange, and things do work in majority of patients. So if you have a stone former in the past, you got to look at a sonography or a CT scan to look at are there any stones still sitting there, because stones do form silently. They make all changes silently till one fine day they're picked up. They could be too big, a staghorn stone or a large stone, or they would have fallen down from the left or the right kidney and cause a ureteric colic when you are on a holiday or a resort, or probably in a location from where you may not get a chance to get treated by the right doctor at the right time. So for all in this epidemiological phenomena of stone formation, which is only getting bigger with passing time, it is important for us to be aware that stones can be treated as early as entering the kidney and clearing them up completely before they cause trouble. Or you pick it up in a health checkup when the stones are big, large enough, and would require a puncture or a PCNL where we enter through the renal angle, enter the kidney and powder, pulverize and fragment and bring all of them out. So that's an aspect of care where we pick up large stones by not pulverizing them and leaving them alone, but powdering and removing all of them and leaving a stent inside to allow the area to heal where the stone was impacted, to allow our punctures to heal. Stones have fallen in the ureter, then the job is to probably do a ureteroscopy in time, because wherever the stone falls, it tries to probably come out by looking at attempting to churn and bring a space out. But remember, a small stone is blocked in the upper ureter or a mid or a lower ureter or the vesicular junction, which necessarily means that the area is too tight. The stone, whatever the size, is bigger than the pipe and therefore cannot come out. Waiting for a medical expulsion therapy and waiting for it to happen forever is a dangerous therapy. Should not be waiting for a stone to be falling out all the time forever, because it causes an injury locally in the ureter and causes a ureteric edema, later on a fibrosis and a stricture formation. And the removal of stone may not necessarily help you all the time. So aspects of care directly are in terms of looking at prevention of stones, picking up stones early, and whenever we pick up stones of whatever size and whatever location, we treat them. People say that if I eat something, stones will form. That's not necessary. Not everybody in the family may have stones. And stones, sadly, is a part of the end result of metabolism of changes happening with the kidneys taking a brunt of. So picking up stones very small, sometimes we ask for a CT scan to quantify and look at the picture in terms of the hardness of the stone, number of stones exactly, and looking at what could be the best option for this individual. So friends, stone formation sadly could happen again and again. It's important for us to identify ourselves, subject ourselves to a therapy, and look at your urologist helping you towards prevention of stone formation by doing a metabolic workup and making a moderate amount of change in your lifestyle, more so in your liquid intake, which could be more of divided water intake across the day and night, looking at some increasing amount of citrate levels. The myth that stones form because of tomato seeds and brinjal seeds and guava seeds is not true. Seeds don't form stones is what from the medical community you've heard multiple times. But it is important to reiterate that again because it's an important aspect. So taking care of the kidneys is in many ways. Improving your water intake. You and I could be lucky that we are not nephrological and cardiac patients where our doctors and nephrologists and cardiologists would have to restrict water intake. So make hay while sun shines. In other words, improve your water intake progressively in such a way that you divided the water intake across the day. More so before every principal meal, that you have hydrated your body well. More so if you're a stone former, you drink water and go to sleep at night. Only for those individuals where they need to understand that kidneys don't sleep at night while you do. Kidneys continue to work hard. And in stone formers where there is always a metabolic activity happening, where the urine is getting super saturated and concentrated, water intake across the day and night would actually keep the urine dilute. Possibly it would allow the entire aspect to be dissolved and not necessarily dissolved after stone formation, but the crystals could be not aggregating enough. They could be seen in a urine routine and a microscopic test, which gives us an idea that we are stone formers, we are crystal creators, and we need to look at stone formation prevention. So there are multiple aspects of care in stone therapy. The first therapy always is if we pick up a stone, we probably do that regularly at the Coquelin Hospital. In the Department of Urology, we continue doing this all the time. We look at picking up stones very early. We land up seeing so many patients coming with ureteric colic and stones falling in the ureter and block. And we know that there are silent stones sitting in when you pick up yourself in the health checkup. So all individuals who have got stones need to see urologist in time to be able to clear the stones. And that's the first step towards the protracted activity of preventing stones in future. Thank you so much.